My name is Dr. Magaji Aminu. I'm a practicing obstetrician gynecologist. I'm a fellow of the West African College of Surgeons. I practice in Minna, Niger State, in Maternal and Newborn Hospital. I was invited to come to Merck Fertility Program by the Merck Foundation in Indira IVF Udaipur, Rajasthan in India. There are a lot of challenges in Nigeria facing infertility couples. There are only very few centers, about 6, 7 in the whole of Nigeria. And in my region, there is no single fertility practice center. The cost is between 2 to 3 million naira per treatment, and that is highly expensive for the average Nigerian infertile couples. So we are left with a lot of infertile couples who needed artificial reproductive technique, especially IVF/ICSI, who cannot afford the cost of the treatment for this, for their conditions. Mainly because not only the costs, the centers are very few. The centers are very few because there are very few specialists in ART specialization fields. Therefore, I think it's a great opportunity given by Merck Foundation for me to learn advanced technique in artificial reproductive technique, IVF and ICSI. There are a few centers for infertility treatment, especially IVF and ICSI centers. There are about 4 or 5 in Lagos and about 4 or 5 in Abuja, Nigeria. Very few for a population of 200 million. You find out that infertility cases that require IVF treatment is as high as 10 to 20% among infertile couples. So if we manage cases and it reached a point where they needed IVF treatments, we would only refer them to centers in Abuja or Lagos, which is a bit far from my region. It is very expensive, like I said, and a lot of my patients that needed IVF treatment cannot afford the treatment. With this training by Merck Foundation or Merck Fertility Program, I'm very well equipped now to start up an IVF clinic in my country. Not only that, I think I have opportunity to know how to present data as to infertile couples who needed IVF treatment, so that can be used for advocacy for government to get involved more on providing centers and training for infertile couples, especially IVF and ICSI technology. I think that I'm better prepared not only to practice IVF in my country, I'm also prepared to make advocacy visit or advocacy plan to government in order to increase especially those who are specialized in IVF technique. Therefore, when I go back my country, I will start with those patients who needed IVF, and then I will practice the technique of counseling, stimulation, monitoring of stimulation of cycles, ovum retrieval, and at the point of IUI, I could be able to provide IUI services and IVF services as well. But I think the challenge now is for me to have clinical embryologists who will help in the laboratory part of the IVF. So as I'm putting on machineries in motion to practice, I'll also pay advocacy visits to the government officials who will help in getting the equipments and then sending more of the personnel in order to come and have training, especially on clinical embryology. When I came here, I was taking run on all the segments of AIV treatment setup. At the OPD, we have learned how to counsel patients. We have learned how to investigate infertile couples and plan the treatments, and also make prescriptions that are required for IVF treatment. We have been taught on ultrasound scan how to monitor stimulation cycles, how to check the endometrium and to know when to do embryo transfer. We have practiced a lot on simulators for hysteroscopy, ovum pickup, as well as ultrasound scan in managing IVF patients. We have also attended the operation theater where laparoscopic surgeries, hysteroscopy, and other operations are done. We have also been practicing and observing. First we observe, and we also has hands-on on how to do pickup of oocyte retrieval in the theater. So overall, we have been to all the segments, and we have had hands-on training on how to perform all the various techniques that is required in IVF treatment. I want to appreciate and thank Merck Foundation for the opportunity it has provided for me through Merck Fertility Program to come here in India and learn the techniques of artificial reproductive technique. Before now, in my country and in my practice, all the patients that I see and manage as infertile couples would only stop at the basics. Once couples will have reached the end point where couples would need infertility management by IVF, we usually refer. But with this training, I think we will take a step forward in managing those couples who require IVF in order to conceive. And overall, the number of patients who have infertile couples that require IVF training will be reduced. We will be able to also converse and educate the populace that there is treatment for their infertility with IVF. Nigeria